There we go. Okay, so we have the privilege of hearing from Rabbi Shimmy Steinmetz discussing IVs and other medical procedures on Shabbos. And without further ado.
Thank you very much. I appreciate being invited back to speak. I appreciate the cute title of not desecrating Shabbos in vain with an E as opposed to an A. I appreciated the title. The discussion is not going to be comprehensive enough as usual, but I'm going to discuss some of the issues that come up from the halachos. As a rabbi, when dealing with medicine, I start with, the halachic knowledge I know and go into the medicine. Oftentimes when, you're a physician who's learned or knows these things, you do the opposite. There are probably pros and cons to both, but that's the way I'm going to start. We're going to discuss specifically IVs and not everything when it comes to IVs. We're specifically going to talk about one thing, which is the Isser of Chavala, the Isser of a Chabura on Shabbos. There are ancillary issues that may arise, but this is really the main issue. The other ones can be dealt with in other ways and in other discussions. We're going to start with really what exactly is the issue that may arise when putting in an IV line. And again, in the end, we'll discuss, the other types of lines, perhaps with practical applications towards the end. But the Gemara at the beginning of Parak Shmona Shratzim in Shabbos, the parak called Shmona Shratzim, which starts on Kuf Zayin Amud Aleph, so that's a parak that really discusses Refuah b'Shabbos at length. You need to know all of Masechah Shabbos because there are a lot of other dinim and rules that come up that are presented in the other prakim, but Refuah b'Shabbos is written comprehensively in that parak. But the parak begins Shmona Shratzim Ha'amurim b'Torah that there are 8 types of creepy crawlies that are written about in the Torah, and Hatzadan, if you trap them, Ve'achovel bahen, and if you injure them, chayiv. You're going to be chayiv, you're going to be over an Isser de'oraisa on Shabbos. Now the question is, achovel bahen, you injure this creepy crawly, what exactly is the Isser that you're over? Now the Gemara discusses that what is going on is the person is causing this creepy crawly to bleed somehow. There's something that's coming that's being removed from where it is and it's bleeding somehow. But what exactly is the Isser? So Rashi already on this daf gives 2 options. The second option, which we're really not going to discuss at all, is a very interesting option that he says that you're over an Isser, there's a Malach on Shabbos called Soveya, coloring. By injuring this animal, and obviously we would include in this human beings as well, by causing them to bleed, you're coloring them basically, whether it's red, whether it's the black and blue mark, but there's some coloration, and that's going to be the Malacha D'Oraisa. That's the second option of Rashi. The first option of Rashi is that this is a tolda of Shochet. One of the Lamites Malachos is called Shochet. Shochet is literally, we know it as means slaughtering, but a subcategory of Shochet is what the Rishonim called Netilas Neshama. The Gemara really calls Netilas Neshama. Netilas Neshama literally means to take a soul. But in this context, so as the Rishonim say, what it means is, we know the pasuk tells us Ki Adam hu nefesh, that blood is considered a soul. So when you remove the blood from its place into another place, removing it is being notel, taking the neshama, which is the blood. It's called netilas neshama, and that's a subset. It's a tolda of shochet. A tolda on Shabbos is an isser de'oraisa, just like an av. So this would be an isser de'oraisa. This is how Rov of Harishonim hold. All the Chachmei Sfarad, the Ramban, the Rashba, the Ritva, Tosos in 2 places, Rashi and Chulin, all say this. This is really what the isser is. The isser of chaval, the isser of creating a chabur, a bruise on Shabbos is netilas neshama. You're causing someone to bleed. You're removing the blood from where it was. The blood is considered a nefesh in it of itself. And removing that is an isser de'oraisa called netilas neshama, and that is what you are doing. And that's, again, the consensus opinion of most Rishonim. The Rambam disagrees. The Rambam writes in Hilchos Shabbos Pereches Halacha Zayin, I put here in the 3rd source. The context of this halacha in the Rambam is a different malacha called dash, threshing. One of the earlier malachos of the Lamites malachos. Dash means if you have wheat, taking the kernel out, threshing it so you can take the kernel out. That's what dash is. Part of dash also is, let's say you take an orange and you do schita and you squeeze it so that the juice comes out. That's also a malacha d'oraisa of dash, what we call schita. Mefarik is when you remove something that's inside something and you remove it. So mefarik would be removing the juices from inside a fruit, for example. So these are all different types of, the av malacha called dash, but the tolda would be called mefarik. So mefarik. So the Rambam here in Parachas Halacha Zayin writes, Hadash kigro garas chayav. If someone does dash, he threshes the amount of a grogeres, you're going to be chayav. Ve'indi shel bigdulei karka, and that only applies to things that grow from the ground. Meaning the av malacha of dash is only from things that grow from the ground. But va'mefarik, you told us hadash. Mefarik is a tolda of dash. Mefarik is again removing something from something inside something else, removing it, taking it outside. For example, hacholiv esa behema chayiv. You milk an animal, that's considered mefarik. That is a malacha deoraisa, mipnei shehu mefarik. Milking an animal, taking the milk that's inside and removing it, that is a mefarik. V'chein, so too, hachovel b'chai sheyesh lo or. If someone bruises a live being that has skin, that has flesh, chayiv mishum mefarik. You are chayiv because of mefarik. V'hu sheyetzarech ledam, as long as he needs the blood, sheyetze min sheyatza min hachabur, that came out due to the bruise. We're going to stop there. The rest of the Rambam is important, but not for now. So the Rambam disagrees with both interpretations of Rashi and says bruising is not simply a milach, or is not a milach of tzoveya. It's not a milach of shochet / netilas neshama. It's a malacha of dash, it's a malacha of mefarik. It's removing something from inside to outside. The blood is inside this animal's body. The milk is inside this animal's body. Just like when I milk the cow, that's mefarik. That's a malacha d'oraisa. So too, when I cause someone to bleed, when I bruise someone and the blood goes from place A to place B, that's an iser d'oraisa, malacha d'oraisa of mefarik, a tolda of dash. Now, how does this apply to what we're saying? So obviously, when someone puts in an IV line, so as you all correctly know, you use the introducer needle, you put it into you find a vein, you try to find a vein, and you advance it slowly until it's fully in the vein. Now, once you're in the vein, so you're trying to slowly move the catheter in, because that's what you want to get into the vein. But as soon as you get into the vein, so there's flashback. The flashback is you have the hub, right, in the starter kit. That the starter kit blocks the blood from going far, but that little hub, as soon as you go into a vein, because the blood's in the vein, immediately you have flashback that goes into the little hub. And that is how you know you're in the vein, right? That just happens, what we call memela. There's nothing, you don't try to put the blood in that little hub, but once you're in a vein, obviously there's blood there. It's going to go into that hub. So the question is, when I put that IV line in, then really the introducer needle, when I put that in and I get the vein, and suddenly blood immediately goes into that little hub until, the starter kit kind of stops that blood. So I'm removing blood from inside the vein, and now it's going out. So anytime I put in an IV, I'm removing blood. So is that removing blood considered in a tilas neshama? Is it considered a mefarik? Again, according to Rashi versus according to the Rambam, let's say, those would be the malachos. But is it the issue that of chavala, of causing a chabura, whatever that may be? Again, whether that's netilas neshama, whether that is mefarik, it doesn't make a difference. The question is it considered a chabura when I'm putting in an IV line and automatically blood is coming out? And that's really, the basis for whatever discussion that there is going to be. So there is a large discussion in the poskim about this concept about putting in IV lines. So for example, what's the halacha before we even discuss the IV line, what's the halacha in terms of chaval in general? So the Mishnah Berurah in Shin Tazayin in Sifkan Chav Tes I have here writes that like that the first interpretation in Rashi that Rov Harishonim hold that it's a problem of netilas neshama, and Mishnah Berurah explicates ki adam hu nefesh, that blood is considered a nefesh. Removing the blood is a problem. Says the Mishnah Berurah in Sifkan Lamed, it's a very long Mishnah Berurah that he discusses that this concept is sometimes looked over in Shabbos, but it's a big problem because it's an Isser D'Oraisa, and he writes towards the middle end, and I bolded it here in Sifkat and Lamed, V'mu makiz dam la'adam l'refuah. Let's say someone bloodlet. So again, nowadays we don't bloodlet, but it wasn't so long ago that bloodletting was a common source of healing, a source of refuah that healers, that doctors, that physicians would do. So let's say someone needs to bloodlet. Kishen bo sakana. He goes for his annual checkup. And it's he does not bisakana, but they bloodlet to make sure he's going to be all healthy. So let's say a person bloodlets whether obe behema or he does it to an animal. Chayev l'kuli alma. The Mishnah Berurah says you are over a melacha de oraisa. You remove the blood. You did netilas neshama, maybe even mefarik according to the Rambam. That is a melacha de oraisa of bloodletting. Duhu bechlal mesakin, because you're fixing the person, etc. You want the blood to come out. That's the way you're healing the person. We'll get back to that language maybe later on, but that's what the Mishnah Berurah says. So we see this is the first time where we're seeing this concept of removing blood, the concept of chavala, of chabura, in the context of refuah, of medicine. That again, for us, it doesn't apply to bloodletting, but bloodletting would be an iser de oraisa, according to what we just said, because you're removing blood from where it was. Now, there are two differences that we have to figure out. A, in IVs, obviously, the idea is not to remove the blood. It's to put in the line. It just happens to be you remove the blood automatically. So that's obviously a big difference. And B, the Mishnah Berurah here, and this is the important, when you're trying to figure out the context of whatever the shaila is, when you're putting an IV line, the first thing you have to figure out is who the patient is. If the patient is a chola sheyesh bo sakana, it's a critically ill patient, so that patient we violate any melachos d'oraisa for. To save the patient, it's pikuach nefesh. It's only if the patient is only quote unquote a chola she'ein bo sakana, he has incredible discomfort, he can't act normally that Shabbos, whatever it is. So when it comes to that person, so you can't violate deoraisas, but you are able to violate some derabanans. So that's why the Mishnah Berurah here is talking about a chol she'ein bo sakana, even a chol she'ein bo sakana, because it's a doraisa, I can't violate. But if we can knock down an IV to a derabanan, that would help by at least by a chol she'ein bo sakana. All right, that's meaning obviously by chol she'ein bo sakana there's no question, but ein bo sakana would still help. So that's again why it's important just to get the context of the patient, of what exactly is going on. So what exactly is the deal with IVs in general? So again, as I pointed out, it's a big discussion in the poskim. The Tzitz Eliezer of Eliezer Waldenberg, who was one of the great 20th century poskim in Yerushalayim, the Abbez in Yerushalayim. He was, I don't know, formally or informally, the Rav of Shari Tzedek Hospital, but he has extensive truvos on medical halacha. Really the first one to have extensive truvos on it. So he has, I put in a bunch of them just here. He has a lot of chuvas about this. In Chelak Ches and Siman Tes Vav, in Chelak Tes and Siman Yud Zayin, in Chelak Tes Siman Pei, in Siman Pei Ches, Chay Tes Siman Chaf Ches, Chelak Yud Siman Chaf Hey, a lot of chuvos. I went through all of these chuvos. Then the last one here is in Chelak Yud Gimel and Siman Mem Hey, and there he writes, okay, now I'm going to summarize all the chuvos that I had in the previous places. So you could just read that one, that last one, and he gives you his opinion. The other ones are short, though, so it's not such a bad read. Anyway, so the Tzitz Eliezer's opinion, basically, to start with, to lead with the conclusion, he thinks that putting in an IV line on Shabbos is only an Isser Midrabana. It's not a Melacha D'Oraisa. Why is that important? Again, it's important because not only would you be able to do that for a Chol She'yesh Bo Sakana, but you'd potentially be able to do it for a Chol She'ein Bo Sakana. Now, why does he think that it's only melacha d'oraisa? So we just said removing blood is going to be a melacha called chabura, whether that's in tilas neshama, whether that is mefarik. And anytime I put in the IV line, the flashback automatically occurs. So blood automatically comes out. So why wouldn't that be a melacha d'oraisa? So what he explains is based off the Gemara in Shabbos and Daf Ayin Gimel Amud Beis. Now, there's a big machlokas throughout the Masechah Shabbos between Rabbi Yehuda and Rabbi Shimon about a concept called a malacha she'eina tzricha legufa. In short, very short, what a malacha she'eina tzricha legufa really is a malacha that someone does. The purpose, though, is not for the malacha itself. You're doing the action of the malacha, but not because you want what the purpose of that malacha. It's a totally different purpose. You need to do that action, but it's a totally different purpose. So Rabbi Yehuda throughout Shabbos tells us that is still, if I did the malacha, it doesn't matter if I wanted something else, I do the malacha, that's the malacha. I'm over the malacha d'oraisa. But Rabbi Shimon says, and this is how almost everyone paskins, that anytime you do the action, but it's she'eina tzricha legufa, I don't need that malacha. I'm doing it for a totally different purpose. It's called pater. In Hilchos Shabbos, pater means pater aval aser, means that it's aser midrabanan, but not midrabanan. So, for example, The Gemara in Shabbos in Daf Ayin Gimel and Beis tells us Achofer Guma b'Shabbos. Someone digs a hole in Shabbos. Digging a hole in Shabbos is a malacha of Choresh. One of the avos malachos of Choresh is also Chofer, digging a hole. So digging a hole, the malacha is to dig a hole because I want the hole. But let's say someone digs a hole, ve'eno tzarich ala la'afara. But he only needs the dirt. He doesn't need the actual hole. He wants the dirt. Let's say. So that's called a malacha she'ena tzricha legufa. I don't need the hole. I just want the dirt. I need the dirt for a totally different reason. So pater aleha, that's up to her. Again, malacha she'ena tzricha legufa, that would be pater. The Gemara says, even Rabbi Yehuda says chayiv, it would be pater here because the only time you can say chayiv is it's when it's a constructive act. But this is a destructive act. When it's a destructive act, making a hole, digging up a hole, that's destructive. So then even Rabbi Yehuda would say it's pater, but leave that aside. Either way, digging a hole, but not needing the hole, only needing the dirt, that's called the malacha she'ena tzricha legufa. You are pater. We hold you are pater is only an Isser Midrabanan. Says Rav Eliezer Waldenberg, the Tzitz Eliezer. That is what's happening here. When I put in the IV line, I have no interest in the blood. It's like digging a hole and wanting the dirt. The malacha here is removing blood. I don't want to remove the blood. I have to remove the blood, but only to get the line into the vein. That's what I'm doing. So that's called the malacha she'ena tzricha legufa, and therefore it's not an Isser Midoraisa. It is only an Isser Midrabanan. In fact, in the Shmir Shabbos Kehilchasan, in the 32nd parak, so it has a very important footnote there. It's Ha'ara Kufnon Ches. There's a long discussion about all of these concepts, and he quotes Reb Shlomo Zalman Auerbach gave another proof. The Shulchan Aruch in Siman Shin Chav Ches in Sif Lamed Hey discusses a woman who's nursing. Nursing, just like we said, milking a cow is a malacha of mifarik, of removing something inside, taking it out. Nursing would theoretically be the same thing. Now, you're allowed to feed your baby, obviously, but if it wasn't in the action of feeding the baby. The Shulchan Aruch says, however, if you need to express your milk in order that your baby can eat, that's mutter. And in the footnotes in the Mishnah Brura, on the Sharet Tzion there in Sifkan Pei Aleph, I put here on the sheet, he quotes the Pri Megadim that expressing can even be on the ground, not just on the baby's lips. Expressing on the ground is totally okay. Why is it totally okay? Because that's a malacha she'ena tzricha legufa. You're just trying to express the milk, not because you want the milk in that case, but you want to be able to feed the baby. Now, it happens to be the only way to do that is to express the milk, is do the malacha of mefarik, of removing the milk, extracting the milk. But again, it's a malacha she'ena tzricha legufa. So too, the Ramah there in that sif says that if someone has his ruach ra, these bad spirits, that I guess they would use breast milk to cure, I don't know, whatever it was. So the Ramah writes that a woman wouldn't be able to express milk on the person who has this ruach ra. But the Mishnah Brura here in Sif Kata and Kuf Yod Gimel, I put again in the second source, he says, if we're dealing with a case of tsar, so there wouldn't be any issue. Because even without what we're saying, this is the definition of a malacha she'ena tzricha legufa. You're not expressing the milk, you're not extracting the milk for the purpose of the milk. You're extracting it for a totally different purpose. And that's called malacha she'ena tzricha legufa, that you're pater. Says Reb Shlomo Zalman Auerbach also, that's our case. I put in a line. It's not that I want the blood to come out. I want the line in the vein so I can give medicine into the vein. Oh, it happens to be blood comes out. That's a malacha she'ena tzricha legufa. That is pater. That's the opinion of the Tzitz Eliezer. Now, many, as he quotes himself, many poskim disagree with this. And many poskim say, no, putting in an IV line on Shabbos is actually a malacha deoraisa. He quotes Rabbi Cheskel Abramsky in the footnote in the Shmir Shabbos. They also quote this. Rabbi Cheskel Abramsky was one of the great rabbanim in 20th century. He learned in Volozhin, then he moved to Eretz Yisrael, but he was one of the great gedolim, so he held that it was an Isser deoraisa, a malacha deoraisa. In the footnote, they quote, maybe they think the Chazon Ish also held this way. The Tzitz Eliezer doesn't agree to that, but there are many poskim who disagree. In the end of the day, Reb Shlomo Zalman Auerbach also disagrees. Reb Shlomo Zalman Auerbach also held putting in an IV line on Shabbos is a malacha deoraisa. He brought a few proofs. And the Tzitz Eliezer, in a few of these truvos, they're truvos to each other. So he's writing to Reb Shlomo Zalman Auerbach because Reb Shlomo Zalman Auerbach responded something to him. So it's in conversation. But one of the proofs Reb Shlomo Zalman Auerbach has is from the Gemara. The Gemara tells us in Ksuvas and Daf Hamid Beis, I put here in the second source on the slide, that the Gemara tries figuring out if a man and woman get married, are they allowed to have their first biyah? Are they allowed to consummate the marriage on a Friday night? Whenever, again, you're going to consummate the marriage, there's always going to be blood that comes from tearing the hymen, and that removal of the blood is that an isser of chabura, of chavala. That's what the Gemara tries figuring out. Is there an Isser Chabura to have Bia Rishona on a Friday night? The Gemara says, the question is, Dam Mifkid Pocket or Chaburi Mechbar? Is the blood, is it considered that's going to come out? Is it considered Mifkid Pocket means it's standing? It's not attached to anything. It's just as if, you have a closet that you have something in there. You open up the door to the closet, it comes out. But that's all it is. Oh, Chaburi Mechbar means it's attached. It's part of the circulatory system. So if it's only Mifkid Pocket, so that's Chabur doesn't apply to that. Because Chabur means removing something that's attached, removing it. But something that was never attached, it just happened to have been sitting there, that's not an issue. So the Gemara says, Vimtim Tzilomer Dam Mifkid Pocket. Let's say you tell me that the blood is only standing there. It's not actually attached to anything. So the Gemara says, Ladamu Tzarech. Then he needs the blood, Ushari. Do we say that the man needs to see the blood, and therefore it's mutter, or not? What exactly does that mean? What that means is, do we see that again if the blood is considered something that is disconnected from, let's just say, the circulatory system? So do we say that when I cause a chabura and it comes out, so there's no problem there because I just need to see the blood, there's nothing else? Or is my intent to create a Pesach, a hole, which would be the malacha of binyan? That's what the Gemara's discussion is. Again, the intricacies are not for right now. But Tosos there ask, hold on a second, this is all the malacha she'ein tzricha legufa. What's the problem to begin with? Right? What's the problem to begin with? When they're with each other, so it's not like they're trying to create a bruise, they're not trying to extract any blood. It's a byproduct of what's happening. So that's called the malacha she'ein tzricha legufa. So why are we saying that? It would be chayiv. Why does that even mean? So one of the answers Tosfos gives at the end of Tosfos is no, because you want to see the blood to ensure that this woman is a psula. So there's a reason to see the blood. That's what Tosfos say. So what Rav Shlomo Zalman Auerbach learns from that is that you see that's called a tzricha legufa, that we broaden the concept of a malacha that you need. Meaning, when we say malacha she'ein tzricha legufa, is when I do an action that's a malacha, but it's for a totally different intention. But explains Rav Shlomo Zalman Auerbach, what you see from here is that a totally different intention isn't that big. Meaning, in this case, you're right, you don't want to cause a bruise, but you're still interested in looking at the blood, to seeing what the situation is. So by the mere fact that you want to look at the blood, that means it's tzricha legufa. Here, when I put an IV line and the flashback occurs and I see the blood, I want to see the blood to ensure that the IV is in the vein. This is what the Pri Megadim writes at the beginning of Siman Shin Lamed Aleph. Rav Shlomo Zalman quotes this. The same thing by Atavas Dam Bris. We're not going to go into it right now. But it's the same idea. Even if you don't need, as he says, she'ein tzarich ledam mamish, the Pri Megadim says, I don't need the blood, but the very fact that the blood is helpful for me, I want to see the blood, for whatever reason, is enough to call this tzricha legufa. And again, that would clearly apply to our case, where you want to see the blood that's in the hub, because that ensures that the line is in the vein. So because of that, Rav Shlomo Zalman Auerbach says this is a malacha d'oraisa to put it in an IV vein. Now it happens to be that Tzitz Eliezer in Chelak Yod of his Truvos disagrees with this, and he says they're two totally different things. When it comes to Dam Psulim, this Gemara in Ksuvos, when the blood comes after Bia Rishona and there's blood, so you want to see the blood because the blood tells you something. The blood tells you that, oh, now I can see the blood. I know what the status was before the wedding. But when it comes to the flashback that's in the hub, I don't want to see it. That's just the only way for me to know that it's in the vein. But if there was another way to determine that the line is in the vein without seeing the blood, says that Tzitz Eliezer, that would be fine with me also. So I don't actually want to see the blood. That's what the Tzitz Eliezer says. It's a very difficult...
If somebody were to tell you that she's a basula, it's the same.
Good. That's what makes it very, very difficult, is that you should say the same exact thing by the psula. If someone were to tell you that I know she's a psula, she won't bleed, but I know for certain, so then why would you want to see the blood? So it seems to be the same thing. Both are an emtzai, but that's, again, what the Tzitz Eliezer at least responds to this proof. Rav Shlomo Zalman brings another proof in his tshuva to the Tzitz Eliezer, and that comes from the Gemara in Shabbos. The Gemara in Shabbos discusses mitzitza bepet. This is in Parak Rabbi Eliezer Demila, and on Daf Kuflam and Gimel and Beis. Mitzitza bepet is by bris mila. So the halacha is that it's supposed to be some sort of sucking of the blood from the arla. Now, I'm not discussing the parameters of this. It is absolutely beyond the scope of this discussion, but it's an important thing to discuss in in the field of medicine. Many don't have the minhag to do it with your mouth anymore. So, but again, there is a concept called mitzitza b'peh, and the Gemara assumes mitzitza b'peh was done to ensure the safety of the child. That if mitzitza b'peh wasn't done, it would be some form of sakana. It would lead to some form of danger to the child. So the Gemara there asks, obviously, you can do mitzitza b'peh on Shabbos. The Gemara says, isn't that obvious? It's a sakana. The baby's b'sakana if I don't do mitzitza b'peh. So what's the chiddush? So the Gemara says, Mao the same or no. I might have thought haidam mifkid pakid. I might have thought that the blood that the moel is going to take out, that was just blood that was just standing there, but it wasn't actually it wasn't attached to the circulatory system. It was just standing. And again, if blood is just standing, there's no isser of chabura, as we said. Right? It's just like you open the door and the blood came out. It's only when it's attached and you cause it to come out. So Kamash Malan, the Gemara is teaching us, no, the blood here is chaburi mechbar, the blood is attached, and when you do the mitzitza b'peh, even though you're doing a chabura, nevertheless, it's mutter because it's a sakana. That's what the Gemara says. Now, Rabbi Shimmy Zalman Auerbach says, hold on a second. What's the question to begin with? What's the reason why you want the blood? You want the blood, not because you want the blood. It's because the child's in danger and you want to save the child. That's what we call a malacha she'ena tzricha legufa. I don't want to remove the blood from the child. I want to save the child. I want to get him out of danger. Now, it happens to be, I have to remove the blood to do it. That's called a malacha she'ena tzricha legufa. So says Rabbi Shimmy Zalman Auerbach, you see that's not called a malacha she'ena tzricha legufa. You see from the fact that there's some interest in the blood, but you take out the blood because the mitzitza b'peh is what saves the child. We call that tzricha legufa. We call that's actually called necessary, and that's called the actual malacha. So it says Rabbi Shimmy Zalman Auerbach, so to the line. Yes, you want to put the line in the vein, and that's the goal. But you want to see the blood. The blood is part of what tells you that it's in the vein. That byproduct is still called tzricha legufa, and it's still a malacha d'oraisa. So says Rabbi Shimmy Zalman Auerbach. But Tzitz Eliezer, in that same tshuva and Chelak Yod, disagrees with this also. And he quotes, I'll say maybe short. He says that this is exactly what the Beis Yaakov asks on Tosos and Ksubis. The Beis Yaakov was written by Rav Yaakov Milisa. Rav Yaakov Milisa was one of the great Gedolim in the 18th century, at the end of the 17th century in Poland. He wrote a lot of very, very important svarim, but he wrote one sefer on Ksubis called the Beis Yaakov. So he explained Tosos and Ksubis, the Tosos that I was reading before. Let's see if I can get it. No, I don't know if I can get it. Okay. But I don't know how to go back. All right, whatever. The Tosos in Ksubis basically asks that how can it be that the Tosos say that dam psulim is called malacha she'ena tzricha legufa. That's what we said before, right? That anytime the blood is coming in, that's called the malacha she'ena tzricha legufa. So Tosos asks, if it's malacha she'ena tzricha legufa, why are you going to be chayiv in the first place? So the Beis Yaakov says, hold on a second. I have a Gemara in Shabbos that just told me that when I do mitzitza b'peh, that's called tzricha legufa. So why would I have thought that the dam psulim is any different? So that's what Tosos said. That is the same question Rabbi Shimmy Zalman Auerbach is asking. And Tosos, the Beis Yaakov brings, and I put here in the source from the Rivash. The Rivash was one of the late Rishonim, the late Spanish Rishonim in the 15th century. So he basically says, anytime that I remove something that's going to make the object better, that is a malacha d'oraisa. When I remove something and it doesn't make the object better, that is not a malacha d'oraisa. For example, when I cut nails, I'm removing the nail from the nail from my finger, and I'm making my nail nicer. So there's a malacha called gozes to cut my nails, but that removal is a malacha because it makes it nicer. And so too with mitzitza b'peh. I remove the blood from the child, that makes the child healthier now. That's called a malacha. That's called whatever you want to call it. It's chabura. It's a chavala. So the only reason we're allowed to do it is when it's a sakana. But by the dam psulim case, that's different because when the blood is removed, that doesn't make the woman any better. It doesn't do anything. So that's not called a malacha. So that's what the Tzitz Eliezer explains. So again, that was a lot of sources and lamdas, but I think it's just to get the context of the machlokas. The Tzitz Eliezer constantly says putting in an ivy line is only malacha d'Rabbanan, and it's called a malacha she'ena tzricha legufa. Rabbi Shimmy Zalman Auerbach and others say, no, this is a malacha d'oraisa, because we see by other cases, whether it be by dam psulim, whether it be by the case of mitzitza b'peh, that removing the blood, even though that wasn't really the purpose, you didn't necessarily want to remove the blood, it was for a different purpose, we still call it tzricha legufa when you're interested in the blood. Whether it's interesting in looking at it to determine a status, whether it's interested in the blood because that ensures the baby is okay, But when you're interested in the blood, so that's still called tzricha legufa. So when I put in a line, I'm interested in seeing the blood in the hub. That ensures that the line is in the vein. So that's again the large machlokas in the poskim. Again, leaving out many details. There's one more proof. I'm not sure why. Oh, there we go. There's one more proof that the Tzitz Eliezer brings to why it would be D'Rabbanan, that he quotes from the Maharam ben Chaviv. The Maharam ben Chaviv, the Maharam ibn Chaviv, was he was a 17th century Achron, Sephardish Achron, who was actually the chief rabbi of Palestine at the time. I think he was, when it was ruled by the Turks. But he died in Yerushalayim. He says that. He brings another kula because he was asked, "Are you allowed to do hakazos adam on Shabbos? Am I allowed to do bloodletting on Shabbos?" That was the question that was asked of him, and he responded, "Yes, because the blood that are in, if you see in the second line in the Tzitz Eliezer when he's quoting it, v'heishiv didam mifkid pakid bivaridim, the blood in veins is considered not attached to the actual body; it's considered as if it's like an object that's sitting." Vein b'mishum netilas neshama, and when you open the vein, it just comes out. It's not that you took it out; it just comes out. It's right now the vein is blocking it, but it's mifkid pocket. It's just sitting there. That's what his chiddush is. So based off that, what he explains is that's the same by putting in an IV line. I put an IV line. The blood comes out of the vein. That blood that comes out was just mifkid pocket. It wasn't attached. Chaburi mechbar. It was just sitting there, and therefore there is no, as we saw from the Gemara in Ksubis, there is no isser of chabur when blood is just sitting there. So therefore, it must be that this is all midrabanan. That's what the Tzitz Eliezer's last proof from this from the Marim ibn Chabiv, and again he quotes from the Rashi in Ksuvas and Dafei and Tosfos, but not for right now. So this is again the
is that lafuke the arteries?
What?
Is that lafuke the arteries? Or like what blood would be in Tios Shama in the body?
Presumably lafuke the arteries, because then again nothing in the circulatory system would be
right.
So presumably, he says specifically the varidim. So presumably, the veins as opposed to the arteries. The veins is when they're sitting. The arteries is when they're attached and circulating. Now, obviously, that's why the circulatory system suddenly becomes a bad muscle, because I'm not a doctor, and I know that veins are also part of the circulatory system. So obviously, there has to be some different definition, sitting versus attached. But that's at least his explanation. So the other just interesting point, and we'll see why this has nafkamina for other practical implications. The other point is, if we held like the Rambam at the very beginning, we pointed out that the isser called chabura for the Rambam was an isser called mefarik. It was an isser. It was part of dash, removing something, extracting a liquid from inside, extracting the juices from a fruit, milk from an animal. The same thing when you extract blood from a person. Now that's what the Rambam called. Now, one of the important nafkaminas between the Rambam and the other Rishonim, there are more than one. One nafkamina, for example, is a biopsy on a cadaver. Now, let's say someone dies, and immediately after they die, so they still have blood. So you want a biopsy, you want to take some of the blood to do whatever testing. So is that considered a nisr chabur? Are you allowed to do that on Shabbos? So it depends. If it's all about netilas neshama, removing that the damu nefesh, the blood is part of your neshama, it's part of your life. So when a person's dead, he's dead. There's no netilas neshama at that point. But if the whole part is mefarik, the whole point is extracting the blood from the body, so that applies even when there's a mace. That's what the Be'er Halacha at the beginning of Shin Tazayin quotes that from the Pri Megadim. That's one nafkamina. Another nafkamina, the Maggid Mishnah already quotes, is a shear. If the whole Isser is about netilas neshama, is about removing blood from one place to another place, because ki adam hu nefesh, it doesn't matter how much blood. The tiniest amount of blood is netilas neshama. But if it's all about the malacha of dash, of removing, of extracting, so there is a shear, there is a minimal shear to that, as we saw in the Rambam earlier. The shear is a grogeres. So anytime you're smaller than that, so then there would not be a malacha of chabura. Now, when the blood goes in the hub, there is a minimal amount of blood that goes there. It's definitely arguable to say that it could be that there would be less than a grogeres of blood in the hub. So according to the Rambam, then maybe there wouldn't even be a malacha of chabura to begin with. Now, as we pointed out, we really hold it's a malacha of netilas neshama, but at least for the Rambam, it may not be an issue. Okay, so now we have machlokas in the poskim. Is putting in an IV line an iser d'oraisa or an iser d'rabanan? Now, from what I understand, but I could be wrong about this. From what I understand, the minhag ha'olam is to follow Rabbi Shlomo Zalman Auerbach and say that it's actually malacha d'oraisa, which means you would only be able to do it for chol sheyesh bo sakana. For chol she'ein bo sakana, we would ideally not put in any IV line on Shabbos. That's the minhag ha'olam. Again, chol sheyesh bo sakana, there's no problem at all to do it. But a chol shein bo sakana, we would try not to. But this obviously leads to a little bit of difficulty. The practical applications are not super simple. Again, we're not dealing. I put this on here because I wanted to make it clear. We're not dealing with sub-Q injections, IM injections, anything that's subcutaneous, intramuscular is going to be at the very least, at the very least, very makel. We're going to be, it's a mutter in most cases. We're dealing with right? We're dealing with the IV itself. Now, what happens? Most hospitals have a policy that as soon as a patient's admitted, you need an active IV at all times. I don't know if all hospitals do. I'm not sure. I never asked, but I think most hospitals do. Again, the idea being that just in case, anytime that they need the medicine, that they should put it in. So what happens if, that someone's on their way out of the hospital, their IV line came out. So the policy is you have to put it back in. You're about to bring them the papers in an hour. You know that they're not going to need the IV line anymore, whether they're being transferred, whatever it is. So then the question is, would you be allowed to, in such a case? Again, if we're dealing with chol she'esh bo sakana that needs it, you put it in. A patient that's admitted to the hospital very often is a chol she'esh bo sakana. But what happens now if you're not sure he needs it anymore? It's policy, but you're not sure he needs it. So that's a serious question. Again, it's a malacha d'oraisa. If it was a malacha d'rabbanan, we would have more room to wiggle. But here it's a more serious question. Another example that was once asked of me is a brain dead patient. We'll deal with that when I discuss central. Fine, let's go there first. But a brain dead patient is another good example. The other question that's often asked are A lines in general. When you have atrial lines, so those obviously, as you guys know, that they're to monitor blood pressure. It's meant to give an accurate blood pressure in real time. So you're going to use it, let's say, in the OR or for really sick patients, because you put it directly into the artery, whether it's the radial artery or another artery. I think usually they do the radial artery, but it goes directly in. It's specifically to monitor blood pressure, but you're putting it in. Now the process is very similar to the IV, but because you're putting it into an artery, there's obviously going to be greater flashback. There's gonna be more blood that comes out. Now that may not be a problem if you have a starter kit that's gonna block it in the hub and it's not gonna be so large, but when you disconnect the starter kit because you have to connect it to the transducer tubing, because that's how you're going to be able to tell what the person's blood pressure is. So often, not all the time, but it's not crazy for it to happen, that a lot of blood will just spill out. It'll be a lot of blood, and you'll have to try to quickly do it. But a lot more blood than a grogeris for sure. So even according to the Rambam, there you're going to have a real problem with mefarik. So that's the only difference in terms of A lines, is that there's potential for a lot more blood loss. So even if you held it's all about mefarik, it's probably going to be an issue. But on the other hand, very often we're dealing with very sick patients in the OR where we're dealing with chol she'esh bo sakana. So it's but it really be the same thing as an IV. Central lines. Again, central lines generally are more dangerous. Obviously, it's next to the carotid artery, or it can cause pneumothorax. It can have a lot of you can have a lot of issues. But conceptually, obviously, it's the same as an IV, but it's much bigger. Whether it's an IJN or subclavian vein or femoral artery, whatever it's going to be, it's much wider. So again, much wider means a lot more blood, a lot more flashback. But again, for central lines, it was asked of me, but central lines, you're definitely dealing with chol she'esh bo sakana. There's really no question. The only question, that's why I brought here, I was once asked about a brain dead patient, that sometimes they put in central lines specifically to brain dead patients so that they can ensure that they'll have organs to donate. So there you have a serious question. If you're dealing with a malacha d'oraisa, which according to most poskim you are, and here, even according to the Rambam, you're going to deal potentially with a lot of blood, because potentially you can, bleed a lot. So generally, yeah, really sick or high risk procedures is where it happens, but it could be that it happens to a brain dead patient. So that's a shaila that needs to be asked. Paracentesis, thoracentesis, but both again, they're there to remove fluid from whether it's a patient's abdomen or lungs or whatever it is. I think usually because of liver failure, if I'm not incorrect. But there, one of the differences that paracentesis, again, and thoracentesis is the same thing. Oftentimes it's to relieve symptoms. It's not necessarily more than that. So that there are positives and negatives to that. Sometimes that means you're not doing anything that's pikuach nefesh and you can wait 3 hours, but other times you can't. I'm not saying you should wait to do it, but there is an interesting, thought to figure out whether you're doing it for relief or you're doing it because there's some diagnostic testing that needs. There's much more reason to be makel in terms of chabura by paracentesis in general. You try to avoid, when you do these things, bleeding as much as possible. Ideally, there's no bleeding at all. So there's a lot more, meaning once that's true, then the fact that there's a psik ratio, that there may be blood, there probably isn't, because we try there not to be blood. So there's a lot more room to be makel because there's not automatically blood for these things.
But it's still mepharic.
What?
It's still
If
mepharic
if
though.
there's blood that comes, meaning the point is again, ideally there's no blood that comes out bichlal. Now, if there is blood that comes out, it would be a combination of davar shein and miskavin and misasek, a lot of other things that potentially would happen because we ideally don't want any blood, as opposed to IV lines, A lines, central lines, where there's always going to be a little bit of flashback and blood that's going to happen, secretion automatically. So that one doesn't necessarily. So there's again, there may still be issues in certain situations, but there's a lot more room to be makel at least. And again, if you're dealing with chol sheish b'sakana, then there's obviously a lot of room to be makel in all these cases. A lumbar puncture also, when we're dealing with spines and spinal fluids. So there's a concept that I was told called champagne tap, which is basically what the ideal is that you want the tap to be purely white, no blood at all. So again, like what I just said in the paracentesis, so you really want there to be no blood, and that's the ideal. And the idea is you don't want there to be any mefarik, you don't want there to be any netilas neshama. Epidural as well is the same idea. And because of that, again, there's probably, again, aside from the fact that sometimes you're dealing with a sakana, there's a lot more room to be makel. Now, again, here also, there's a difference between, very often it's, I think always actually, except for that epidural, but the lumbar puncture is going to be for diagnostic reasons, which means that very often it will be because of chol sheish sakana that you're trying to figure out what's going on. Epidural, if you're dealing with a yoleda, someone who's about to give birth, so that's also chol sheish sakana. So there, it's a relief, but you would also have it. As someone brought up chest tubes also, chest tubes are always emergency, so there's really not much to talk about because you have to do it because it's very rare to drain, to release that blood I don't think there's really much of a question. So is there a difference between diagnosis and therapeutic? In terms of doing all these types of lines, potentially, but it just depends on the situation. Diagnostic can be for chol sheish b'sakana, sometimes the chol shein b'sakana. That would be the difference. Therapeutic can be chol shein b'sakana, yesh b'sakana. So there's no blanket difference between whether it's diagnostic or therapeutic. The difference is in terms of the patient and what the needs are. Is there a difference between a doctor and a nurse? So the reason I ask that is because, as I said before, in many hospitals, the policy is that the IV line should always be in. So in the case that I mentioned, if a patient is on the way out of a hospital, and they're leaving in 2-3 hours, so as a doctor, sometimes you have a little more leeway to make such a decision. You have a little more autonomy. Nurses really don't. Nurses, if you don't follow protocol, you can get fired. Doctors, you can get reprimanded a little more. So because of that, there may be a difference just in terms of what's necessary. Again, for other reasons, but nurses may just have in terms of the reaction, they may have to follow protocol in those situations a lot more. A doctor should also follow protocol in almost all situations. It's there for a reason, but there's a little more leeway for doctors. The nurses have a lot less leeway, and that was the idea of going against hospital policy. So again, I never recommend going against hospital policy ever, but there are different thoughts that have to be thought out in terms of whether there's going to be, when we're dealing with whether it's a yesh bo sakana versus ein bo sakana, are we dealing with a case that's definitely a line that's definitely a malacha d'oraisa like an IV, or something that very possibly may not be a d'oraisa, such as things that there aren't psik ratios, it may not happen, like the lumbar puncture, etc. Those have to be asked, and whether the reason you're doing it is it because you're relieving a symptom that the patient is having right now, or is it because you want to test something that you can test the next day? These are all questions that again I don't have answers to on the spot, but each situation is going to be different, and they all need to be asked up. Okay, and we'll stop here.
Is there a difference between blood and like other bodily fluids?
Presumably not in terms of mefarik, in terms of the malacha of chabura, what we call netilas neshama. Yeah, that only applies to blood. In terms of other liquids, so same way that milking a cow and having breast milk come out of a woman, they're both considered mefarik, so it would still be called mefarik, but mefarik has different dinim for the
Yeah,
Rambam.
according to Eliezer, that venous blood would be he holds venous, right? So didn't Eliezer say that venous blood would be mifkad pkidi?
he held, aside from the fact that it's a melech shein tzarich legufa, he had another reason that perhaps it's mifkid pocket. Yeah.
So that would be the same with other fluids in the body, or
Potentially, but again, mifkid pocket only solves a chabura ish. The question is whether this is a big discussion. The Minchas Chinuch asks this question on the Rambam. If removing the blood is based off of mifkid pocket versus chaburi mechbar, and the only time we would have an isser of chabura, which is according to the Rambam mefarik, is only when it's chaburi mechbar. So why is that true? Meaning it's a strange thing. If it's about extracting, if it's one thing, it's about causing a bruise and removing the blood. But if it's all about just having the blood come out, so when I milk a cow, the milk is not chaburi milchbar. It's mifked pug. It's sitting there in the udder, and then it comes out. So why would blood be any different? So this is a big question the Minchas Chinuch asks. I've discussed it in the past, but it's an important question to try to figure out. It's within the Rambam. We probably don't hold like that Rambam, which is why it's less important. But it has to be figured out how. But it speaks to your question. If we're dealing with something that's mifkid pakid, then there shouldn't ever be, and there shouldn't be a case of mefarik, or there should always be a case of mefarik. So why wouldn't there be? It's not so clear. It's complicated. The Minchas Chinuch asks that question.
where's that Minchas Chinuch offhand? Do you know?
When he goes through the his things on Shabbos, so he had one in the Malach of Dash, he asks it explicitly.
There are two questions in the chat. I mean, one I asked about, would everyone agree that if theoretically there's no flashback, then it wouldn't be a deraisa?
So that would be like, for example, if you have a champagne tap on a lumbar puncture, it wouldn't be doraisa. Yeah, that it would be hard to say that that's doraisa. Again, what you're getting is for the procedure. We're not talking about the malach of chabura. The only question would be is whether we're talking about the malach of mefarik. But again, according to Rov HaPoskim, that's not what's going on here. So it's very possibly not a malacha doraisa if there's no flashback.
Another
No,
question.
I had a misunderstanding originally. I used to think that when you put an IV line, you had to pull something back to get the blood, but you didn't have to do that every time. Until I was told, whatever, a year or two ago, that that's not how it works. It comes automatically. Um, but yeah, but I used to think that the question that was just asked, that's what I used to think that, you could put an IV line without any, but that you can't do. But other things you can do, and presumably if there would be no Isser Chabura. I'll say it that way. There's no Doraisa of Chabura if there's no flashback.
Okay. There's another question in the chat also. How does this relate to unwrapping a bandage, which will allow blood to start flowing out of the wound? Can that be dush as well? You aren't really making a chabura, but you're allowing blood to start flowing out. So
No. The reason it's not is because dash is only when it's inside. There's no dash on the outside. If I would have if your wound is already open, so that's what we call mifkid pocket. That it's like sitting there and you just open up the door and it comes out. So that's not dash. Dash is only when it's chaburi mechbar, it's attached, it's inside something, and it's attached in a way that I open it, and by opening it, it's not just I let it flow out, but I punctured it so that it now comes out. But dash is only by chaburi mechbar, not by mifkid pocket, from the Gemara Ksuva. So therefore, unwrapping a bandage would not be an issue of dash.
that would be even if the wound is healed already, and by removing the bandage, you're going to cause it to come open. Would that be the same thing?
And you're removing the band. Let's say you have a scab or something.
Yeah,
That's what you mean.
exactly.
I don't know. I'm not sure. Would have to think about it. I don't want to answer offhand. I don't know. I'm not sure. I would still assume if it's still enough where by simply removing it, the scab is so thin that it just comes out, that would still be mifkid pocket, I would assume. That it's not really in yet, but I could be wrong. I don't know. I have to think about it. It's a good question. I don't know.
Okay. Very good. Thank you very much, Rabbi Steinmetz, for the shir. Great, very informative. And hopefully we can hear more from you in the future.
Great. I always enjoy being here. So thank you very much for the invite. And everyone should have a chag kosher v'sameach.
Thank you very, very much.
Thank you, Rabbi Shimmy.
Bye-bye.